Doctors of Reddit, what's something someone came to the hospital for that they thought wasn't a big deal but turned out to be much worse? My dad went into the hospital with some chest pain thinking it might be a heart attack. They kept him overnight positive it was nothing wrong with his heart. Not a heart attack for sure though. The next morning they gave him a stress test and an hour later he was helicoptered to a heart specialty hospital for a 10-hour open heart procedure. My dad had a bicuspid value instead of a tricuspid in his heart. It had caused an aortic dissection where the inner lining of the aorta tears and blood starts pooling between the layers. If he had gone much longer he would have died. But he is fine now. Very lucky in this case. I'm an ER nurse. I cared for a patient that came in because she woke up with a severe headache and a knot on her head. She went to CT for a head scan and had 2 bullets in her head. One had gone in at the top of her head, just past her hairline and traveled under the skin. But on top of her skull to the back of her head. The other went straight in. But just fractured the skull behind her ear, didn't go all the way through the skull. They were smaller caliber bullets. Apparently. She went to sleep the night before after taking an Ambien and there was a drive-by shooting on her street. The bullets went through her window and she slept right through it. When I was doing my hospital placements, a patient came in laughing and skipping for their scan. They thought 100% they were in remission and clear of cancer growth. I was spending a day with the scan techs and sat in. The scan didn't show one tumor. It showed hundreds. The guy was riddled with metastases. It was terminal. He had months. He was laughing and smiling with us. He asked if we could tell him how it went. And the tech said we couldn't. It was for the doctor. The old man winked at us and walked out. He was so happy. It was one of the days that told me I couldn't do that job. Edit. I've had quite a few people ask what I do now. How did I got into it? I edit a medical journal. I might do an AMA or something. My dad went into the hospital in some pain. Back when he used to power lift. A nurse comes into the room. Looks down at her chart. Looks back up and says, "Mr. Pickle, you are having a heart attack." He got up on the bed and flexed saying, "Does this look like a man that's having a heart attack to you?" Double quote. She looked back down at her chart. Up again. And says yes. Double quote. Edit. He lived through this. For those asking. He has since passed. But not from anything heart related. Following the heart attack he stopped with the powerlifting. And got way more laid back. He started running more than lifting. And learned to appreciate food a lot more. This was his favorite story to tell. I'm glad you guys could appreciate it. See. Had a guy come in complaining of a cough and difficulty swallowing. He thought he had tonsillitis and just wanted some antibiotics. I noticed his voice was incredibly hoarse but there were no swollen tonsils, so sent him for a chest x-ray. Huge, baseball-sized tumors all throughout his lungs. One of them was pressing on the recurrent laryngeal nerve causing his speaking and swallowing problems. He died within a week. Don't have much time so I will keep this short. Patient presented with a small, less than 1 inch, scratch on his right thigh and severe pain and immobility. On palpation there was crepitus, a cracking sound. We called in a surgeon in the hopes that we could excise the closed wound. But as soon as the surgeon cut the skin the leg deflated. Yes, deflated. The escaped air was horribly putrid in odor. We ordered an x-ray and discovered the leg was simply skin and bones without any signs of muscle. I regretfully informed the patient that we had a strong suspicion of a flesh-eating bacteria called Clostridium perfringens and that the infection was spreading fast. He called his family and loved ones, got a lawyer and said his goodbyes. 12 hours after admission he was declared dead. Not a doctor but I was in a fender bender car accident. I was at fault, and my lower back would not stop aching. I went into the ER figuring I had sprained the muscles in my back and that I would be prescribed muscle relaxers and maybe some pain pills. 6 hours. Several x-rays. A CAT scan and 4 doctors later. I found out my spine was broken and, get this, healed. The best theory any of them could come up with was that my spine had broken during birth and since we never knew, it just healed itself. Filling in with cartilage. One of the docs told me that had we known my spine broke at birth I would have likely never walked and would have been treated as handicapped my whole life. I didn't find out until I was 20 and already had a child. My mom cried because she always thought I was just a really colicky baby, when in fact I was probably in a lot of pain. The 7th of December, 2012. We brought my father-in-law to the ER because he just wasn't acting right, mixing words. Feeling tired. My husband and I thought for sure he had a mild stroke. The ER staff thought he had a stroke too, because of his symptoms, and he was 79. They did a scan and nope. Cancer. 3 huge tumors in his brain. We took him for more tests the next day and it was lung cancer. A tiny spot in his lung that traveled to his brain. He died 13 days later. On my husband's birthday. Not a doctor, I'm an EMT. But when I was deployed to Afghanistan as a medic, a medevac pilot came in because he had a small abnormality on his flight physical EKG. Apparently this was something he had been getting waivers for years for. I had just finished an A&P class and learned about something called Brugada syndrome, which is basically an arrhythmia that causes sudden cardiac death in the patient. I jokingly mentioned how his EKG reminded me of the abnormality I saw in my textbook, thinking there was no way he actually had it and it had to be artifact from the EKG. The doctor's eyes widened and he sprinted out of the office. The pilot had it, was immediately relieved of flight duty, sent home and had a defibrillator put into his heart before being medically retired. TLDR, I accidentally diagnosed a man with certain death. Edit. Holy cow, this really blew up. Thanks for the gold. Kind stranger. When I was 12 I had a crazy bad headache that wouldn't go away. My dad brought me to the doc and I didn't even make it to the exam room before they turned me back and sent us to the hospital. It turns out my headache was from a burst sinus cavity. As in, all the bones around my eye broke and the liquid leaked back onto my brain, giving me brain meningitis. My eye was bulging out to the point where I looked like an alien and they told my parents I was not going to make it. Obviously I pulled through but was hospitalized for 2 weeks and missed 2 months of school. I was at the time only the 3rd known case of this happening and they had flown in doctors from all over the US and from the UK. Crazy stuff. I thought it was just the worst headache. Turned out to be so much more. My mother was in town visiting for Christmas. Suddenly she was slurring her speech, acting belligerent, and all around confused. Tested her blood sugar and all it said was error. We get to the ER and she passed out. Her blood sugar was a 19. Her liver spontaneously failed. The best the doctors can guess is she caught a virus and it attacked her liver. 4 days after the onset she got a liver transplant. A 22-year-old woman in Baton Rouge, Louisiana gave my mother the ultimate gift. Please. Become an organ donor. Please. Not a DR. Either, but this happened to me. About 4 months after I had my son I started to notice a vision in one of my eyes was really off. Blurry. Spotty. Etc. I didn't really think about it much because my eye didn't hurt and wasn't itchy and I had a new baby to take care of. Anyway, it lasted for months and finally my mom and sister convinced me I had to go to the IDR for it to see what was going on. I took baby with because I thought, hey, quick apt. Maybe 20-30 minutes and I'll probably leave with some eye drops or something. Honestly, one of the worst days of my life. They put me through test after test. I was there for hours. I ended up calling my mom to come get the baby. They weren't telling me anything. They scheduled an MRI for the next morning because by this time my 11 AM appointment had dragged out until 5:30 PM and the clinic was closed. We were the only people there. Still no answers. I am freaking out. Go back the next day and get the MRI done. They send me to the neurologist, this time no IDR. Today. When I walk in he has all the results from my tests the day before and the MRI I had just taken a while before. I was told I had multiple sclerosis. It was very scary. Edit. They edit too. For those that have asked, I'm doing pretty well. Still in the first stage of relapsing remitting MS. I've stayed hardcore on my therapy and my family is extremely supportive, which makes a huge difference. The first years were the hardest with a toddler and learning to adjust. Now he's 10 and more self-sufficient. We decided not to have more children, which was really hard, but overall the best decision for our family. We got an older patient in the ER because he fell from a stool while replacing a light bulb. The family just wanted him to be checked because he fell on his head. He had nothing. While waiting for the papers, the family started to scream, "Doctor! Doctor!" When we rushed in, it seemed as if he was having a cardiac arrest. We put him back on the bed, hooked up an ECG. He had an AV block. So the reason he probably fell from the stool was because of the AV block. At first he was such a happy guy and joking around. After we told him what he had, he could only say it in my heart. This means the end is coming. And then BSP. TLDR. Came in because he fell from a stool. Fell because of a heart condition. Not a doctor but a nurse. I was working in postpartum care and I cared for a patient who had come into the hospital in labor with her first child. She ended up requiring a C-section. In the OR, they opened her up and found her belly full of cancerous growths. They immediately paged an oncologist at a neighboring hospital, we were just a women's and children's hospital, to come immediately while she was still open. It wound up being terminal. She wouldn't even have known if she hadn't needed that C-section. Can you imagine going to the hospital to have your first baby and leaving with a diagnosis of terminal cancer? I think about her all the time. Not a doctor. But this did happen to me. I had gallstones for 3 years or so before I finally got my gallbladder ripped out last year. At its worst, I was getting an attack maybe once a month or so. So I figured it couldn't be that bad. I went to the surgeon for my post-op checkup. He told me that my gallbladder was filled with hundreds of stones of varying sizes and that it was precancerous. Apparently, people don't typically get gallbladder cancer until they are in their 80s or 90s. And it is often very serious because people don't catch it right away. I'm in my 20s and like I said, I had been sitting on this problem for 3 years before I finally toughened up enough to get it checked out. Scary shit, man. I worked in an ER fast track when a mother brought her 8-year-old daughter for abnormal discharge. Aside from the age, this is nothing unusual as we see many complaints like this throughout the day. The mother thought nothing of it. Maybe she's on her period. The doctor, however, was suspicious from the start. So he ordered a gonorrhea chlamydia test which turned out positive for gonorrhea. Unfortunately, we had to discharge the patient on the initial day due to some tests, such as cultures, taking much longer to result. But the very next day we checked the results and immediately started calling CPS. The mother was not happy, to say the least. My friend's mother was on vacation in Key West and as they were walking down the beach her husband pointed out that the toes on her left foot were all sandy and the other one wasn't. She had been kind of dragging the front of her foot, but only on the one leg. The mom vaguely mentioned that she'd been kind of having a little trouble lifting the front of her foot up, but figured she just strained something from running barefoot on the beach a few days earlier. She went to a doctor to see if she could get some anti-inflammatories. After questions and recommendations to see a specialist, they figured out that she has ALS, Lou Gehrig's disease. This was 6 years ago. Now she is totally unable to move, talk, and breath on her own. All she thought she had was a sprained foot. We had a guy who showed up to the ED with a bad cough. His wife kept saying that she had tuberculosis 20 years ago and although she was treated at that time she was convinced he had it. His symptoms were far more consistent with pneumonia and he lacked classic TB symptoms. We got an X-ray and sure enough it was TB. Now I have to do several blood tests over the next few months to ensure I don't have TB. Sometimes the patient is right. Another time I saw a lady in the ED with a chief complaint of headache. She basically provided no history and just kept repeating that her head hurt. I tried to get some background, past medical history, etc, but she wouldn't say anything other than my head hurts, give me something for the pain. On her chart she had tons of previous visits for vague complaints and requests for narcotics which all resulted in basically nothing. So I initially thought maybe she was drug seeking, but her behavior just seemed odd. We decided to scan her head and left to go see other patients. I came back a few minutes later and her husband was there now. I asked what happened and he said she was just standing in the kitchen cooking when all of a sudden she dropped to her knees and then immediately complained of a horrible headache. While I was talking to him she began vomiting all over herself. We rushed her to CT and she ended up having a subarachnoid hemorrhage, bleed in her brain. She was taken straight to surgery and ended up being fine after spending about 6 weeks in the hospital. Pharmacy student. One of our first, real, patient encounters was within a free clinic. Lady gets there. And after going through the routine questions, complains of an itchy foot. Okay. We'll look into that. We were being graded on this by our professors, who were sitting in with us. But we had to keep on task. Make sure you go in a specific order. So I'm going through this lady's meds. All is well according to her. Takes all meds on time. Though she doesn't exactly remember the names of them, a large part of the assignment was to teach us how innocently ignorant some patients are. She's getting her refills on time. Seems to check out. I see you haven't refilled your diabetic monitor strips in a while. Are you in need of those? Oh. I haven't used that in a few months. It broke. Oh. Well. It's important that you start using that. Skipping some irrelevant talking. Okay. So let's check that foot out. Dot. Horrible hygiene and signs of developing necrosis, but caught in time. This sweet old lady had no idea her diabetes could cause such a problem. I don't work in medical. But a few years ago, I started getting a really bad stomach cramp. I couldn't bring myself to eat or drink anything. And I finally decided to have my mom take me to the hospital. I got in and they decided to take a CT scan of me. Well, being a 6 foot, 15-year-old at about 140 pounds. I had to drink some sort of liquid stuff to basically get my insides to show in the scan. Been a while. Don't remember what exactly it was. Tasted like watered down Sprite. Turns out I had acute appendicitis and they had me in the ER in about an hour. My mother keeps telling me about waking up in the recovery room and being high as a kite. I don't remember a thing. I'm not a doctor but a few years ago I took a positive pregnancy test. I went to the doctor to confirm just thinking I would be getting some blood work done and maybe an ultrasound. They did the ultrasound but couldn't find a baby in my uterus so they told me it was ectopic, implanted in a fallopian tube, and I needed to have surgery to remove the baby. I went into surgery and woke up a few hours later. The first thing I remember is seeing my parents and my fiance crying. Turns out I was never pregnant. I actually had a tumor the size of my fist on my ovary and my body was reacting to it like a baby. I had an HCG hormone and everything. I'm 4 and 1/2 years in remission. Nurse here. I was working a shift in a busy emergency department and a man in his 60s walked in with vague abdominal pain symptoms. After waiting for over an hour in the non-urgent section he came up to the counter saying his pain was worse. He was calm and polite through the whole thing. Next thing we knew he collapsed and his heart stopped. Turns out he was having a massive heart attack. We amazingly got his heart going again and just before we sent him to the cath lab he was sitting up and was as calm and polite as before. I was working as a doctor's scribe years ago at the time in an ER and saw an old friend of mine on the patient list with a diagnosis of a cough. For 2 weeks he finally came to the hospital because he had a cough the last day with a small amount of blood and decided to have it checked out. The ER doctor who checked him was the one I was scribing for, so I was in the room and went through his labs and such. We got his chest x-ray. Wasn't good. And CT confirmed it. Lung cancer. What's terrible is that he never smoked, didn't drink, and took care of his body. He was a very quiet, calm, and nice guy. He was then admitted and started treatment which did not go well. He then went to Florida to try some experimental treatment a few months later. I remember sending him a Facebook message seeing how he was doing. And he said that he felt weak and sick still but also mentioned he was starting to feel slightly better. This was the last message I received from him, as he passed away 1 week later. Not a DR. Found a lump in my breast. Went to ER. Got an appointment with a specialist 2 weeks from then. Night before my appointment I just couldn't get comfortable. It hurt to lay down. It hurt to sit up. It just sucked. I went to the ER in hopes of getting some pain meds. They took me back and started poking around. Told me I had a fever of 104 and that they were going to have to operate immediately. When's the last time I or drank anything? Turns out the lump was an infection and the abscess was on the verge of rupturing. Had the surgery. Spent 7 days in the hospital. Better than cancer, I guess. In 2012, the 3rd of June, I decides to try wrapping myself in saran wrap and a heavy bathrobe to sweat and try and get rid of chronic hives around my torso. I sat down and watched Captain America like a human casserole. That night after a deraping I found my whole torso numb like it had fallen asleep and wouldn't wake up. The next day the numbness had spread to my hands and legs. I was too embarrassed to say anything for a week until my whole body became impossible to move. Went into ER. Then MRI. Still didn't admit the cellophane thing. And found out that rather than just a dumbus allergic reaction to being the human casserole for a night, I had multiple sclerosis and my spinal cord was riddled with inflammation. 10 infusions. Tons of drugs. Paralyzed for 3 months. And physical therapy every other day. Literally the worst year ever. Of course. Not a doctor myself. But this is what happened to me. About 4 years ago. I was at work and was just feeling crappy. Chest pains. Shortness of breath. Shaky and chills. Thought it was the flu with heartburn or something. I ended up finishing work that day and having my mom pick me up and take me to our local hospital. Since I just thought I would go to the ER. Get some meds and go home. I didn't even think to go to the ER at the state-of-the-art urban university hospital that I work at. I was 27. I didn't think it could be anything serious. Got to the hospital. Was admitted right away to the ICU. Where I spent 4 days. Turns out a mysterious virus had attacked my heart. Causing myopericardite or a buildup of fluid in the heart. They tested my blood for everything they could think of. But they still have not been able to figure out what it was. Was put on meds. Released and out of work for 2 months. Fast forward 2 months and I can't lay down without coughing. Go in for chest x-rays. Turns out I am now in heart failure because the virus damaged my mitral valve so much that it now needs to be replaced. I had open heart surgery a few months after that. All because of some mystery virus that didn't even get named after me. Not a doctor but my own story. Woke up one morning with severe pain in my abdomen and trouble breathing. I thought it was from a pulled muscle and gas pains. But since I was pregnant I knew I needed to get it checked out. Ruptured ectopic pregnancy. I was internally bleeding for 2 days. The pulled muscle I felt was my fallopian tube bursting. I should have been in worse condition in terms of vitals. But by some miracle I was okay. Surgery removed the tiny baby that tried to kill me. And I lost a tube. Happy ending. I managed to get pregnant again by some miracle 6 weeks later. We were not trying. We now have a 28-pound happy and healthy 8-month-old baby boy. My son was 7 months old and had a fever that wouldn't go down. I tried Tylenol. Cool bath. And it kept rising. He was my 3rd baby. So I wasn't terribly concerned. But we were leaving the next day for a weekend at a remote cabin. And I thought I should get him checked out and get some antibiotics for him. I called the clinic just as it was about to close. They stayed open for me and when I walked into the empty waiting room, he vomited all over me. The doctor looked in his throat and in his ears. Then turned to me and said, "With your permission, I would like to do a spinal tap." They ushered me out of the room. Then called me back in a few minutes. The doctor showed me a vial of fluid and told me that because it was cloudy, that he had spinal meningitis. She asked me if I was okay. Then told me, very calmly, to put the vial in my purse. Take my baby. Drive directly to the hospital. Go into the emergency entrance. Walk directly to the elevator. Go up to pediatrics. People would be waiting for me. I did as I was told. When the elevator doors opened, there were about 5 people waiting for me. They took my baby from me and hurried away. The next time I saw him, he had tubes and sensors all over his body. It was a scary night, but he made it. I knew he was going to be alright the next morning because while I was nursing him, someone came in the room, and when the door closed, he did that baby startle thing, hands in the air. With meningitis, the hearing is the first thing to go. 10 days in the hospital, but full recovery. The clinic receptionist that kept the clinic open for me later told me that she just had a funny feeling when I called. A 20-something pregnant woman went into her local ER for nausea, vomiting, and a sore back between her shoulder blades. The PA had the amazing stroke of brilliance to ultrasound her shoulders. What did he find? An aorta aneurysm, ballooning and starting to split. She had 2 hours to live. She was immediately thrown onto the survival flight helicopter and flown to my hospital, 120 miles away. Her husband came in from parking the car and asked where she was. He was told she was on the copter and might live if they got to the big house in time. Apparently he laughed and said, "No. No. My wife came in with flu." Double quote. After they set him straight, he drove like a maniac down to us and almost beat the bird. About 3 months ago I had something peculiar happen to me. I was at school in the morning and got up to throw my breakfast away. When I got up I got a severe pain around my belly button. I thought I just had a bad cramp or had to shit, so I just tried to walk it off and stretch out. It didn't go away like a cramp usually would. Or weary whatever, I have a test, I'll go shit when it's done. So I took my test, took a shit, and still had pain. Well, fuck, might as well go to the nurse. I went to the hospital and the surgeon said I needed my appendix out. When they started to do surgery on me, they usually would start by making an incision under your belly button. For some reason they couldn't do it. So they made 3 other incisions on my left side and found out my umbilical cord was still attached to my intestines. Not only that, but my intestines were free floating, not attached like a normal person's. They patched me up and told me I'll need more surgery soon for my intestines, and they took off my umbilical cord. Still got a 96 on the test. TL. Doctor, I was more attached to my mom than I thought.